This morning, topic, spinal stenosis. How many of you have heard of or have or know someone with spinal stenosis? Chances are we all will experience some level of spinal stenosis, right? And that's a type of arthritis. And I know, guys, you hear osteoarthritis. Osteo just means bones, right? Where else are you going to get arthritis? Can you get arthritis in your biceps? So I know people call it osteoarthritis, and that's the actual technical medical terminology, but we could just call it arthritis and be okay, you know? So spinal stenosis, and you have to understand too, the brain and the spinal column, that is the computer, right? Your brain is the computer of our bodies. The spinal column, our spinal cord, that is the superhighway where all the signals that are going to travel to your hands, your feet, any part of your body, that's the highway it travels down. And spinal stenosis is a narrowing of that spine. It's a type of arthritis. And when it comes to falls, right, it can increase your risk for a fall. Now, it's not going to increase your risk as much as neuropathy or a neurological disease like Parkinson's or dementia, but a fall can cause spinal stenosis. That's something I did not know. A fall can cause spinal stenosis, which is a narrowing of the spaces in the spine resulting in compression of the spinal cord or nerve roots, right? So you know how our vertebrae were stacked like that, okay? And then spinal stenosis just closes those spaces there, right? So, and it can pinch on a nerve, and if it's in your neck, your hands tingle, and your feet, your toes will tingle. And so what we're looking at is this condition. It can be painful. It can cause neurological problems, right? Things, Parkinson's, dementia can make them worse, could exacerbate those. Falls are the leading cause of spinal cord injury after the age of 65. It's natural for spinal stenosis to progress over time due to the compression of the spine caused by aging. If spinal stenosis occurs, it can be caused by a specific condition such as a ruptured disc or an injury. It is caused by the narrowing of the vertebrae openings within the spine, what we just discussed. It can cause pain, numbness, weakness, and in some cases, severe bowel or bladder problems. It's common in older people, but it can also affect younger people. I have a touch of spinal stenosis, right? It is caused the canal narrowing. It can lead to pain. Genetics and lifestyle are factors to blame for this disease, and surgery and medication can be used to treat it. If you're diagnosed with spinal stenosis and live with it, you may be unable to work or perform normal activities on a daily basis, just depending on how bad it is. And there's also a note down here that if it's bad enough, you could qualify for Social Security disability benefits. So that's a little note there. Now, does spinal stenosis happen suddenly? In the case of stenosis, your symptoms may develop gradually or abruptly. The symptoms of stenosis typically worsen over time. A dull ache can be agonizing, or more intense pain could be excruciating. Tingling, numbness, muscle weakness may occur in addition to pain, and that's happening because of those signals getting to those muscles on the nerves, the crunching on those nerves, right? That's what's causing that discomfort. So between 2005 and 2014, a total of 6,408 people with traumatic spinal cord injury, we're going to call that SCI, right? Because everything has to have an acronym, were recruited from the national database, the National Spinal Cord Injury Database. Slipping, tripping, stumbling were the most common causes of falls induced with spinal cord injuries in 20% of these cases. People over the age of 61 had the highest rate of falls. So it does increase your fall risk by about 20% is what this study is showing. So guys, all this information is online. I post all my sources. This is from Brandon Orthopedic Associates. So that's a spinal group that I like to get our information from. Sources, resources are always available online. So if you want to pull this information, go to sources, references and sources, scroll to the bottom of the page. It's all there. Everything, every lecture I've ever done, I've always posted my sources, right? Complete transparency here. I don't want you guys to think I'm blowing smoke, okay? So there's got to be, gosh, 100 different sources there, references. So with that, we're going to get started. You guys know this is Balance University. 4 pillars: strength, posture, flexibility, and of course balance. Our goals are to keep you strong, mobile, and independent for the rest of your life. So